Computer. And you're on.
Hi, everyone. I'm Cora Long. I am the Substance Misuse Prevention Coordinator for Strafford County Public Health Network, and we are a program of Greater Seacoast Community Health. I'm here today with Suzanne and Elaine, and we're going to be talking about how May is Mental Health Awareness Month, as well as next week being National Prevention Week, being May 14th is Suicide Prevention Awareness Day. So I just would love for Suze, if you could introduce yourself.
Yeah, thank you, Cora. I'm Suzanne Weete. I work for Community Partners, which is one of the 10 community mental health centers within New Hampshire. And specifically with Community Partners, with lots of community members, we've formed what we call the Dover Mental Health Alliance, which is a community education piece regarding mental health, education, awareness, and suicide prevention.
Awesome. Elaine?
Yeah, so I'm Elaine de Mello. I'm the Director of Suicide Prevention Services at NAMI, New Hampshire. And I'm really thrilled that we're working with you on this. It's a really important topic and it's really timely. So thank you for including me.
Thank you for joining us. So I did want to kind of dive into what National Prevention Week is. It's a SAMHSA's event and initiative that raises awareness and education around mental health and substance use disorders. Every day of next week revolves around a certain theme that involves mental health or substance use disorder. Again, so May 14th is Suicide Prevention Day, and I just kind of wanted to discuss suicide prevention and what it looks like in our community. So part of my job as a substance misuse prevention coordinator, I also focus on mental health initiatives as well, raising awareness and education opportunities and removing stigma around mental health disorders in our community. One of the things that I've done is I've done a lot of work with the Dover community, the Dover Mental Health Alliance. I sit on the steering committee, and part of the work we do is raising awareness about mental health disorders and why mental health is as important as physical health. But I also wanted to have a conversation about how we recognize a mental health challenge versus a mental health crisis. What are some signs that we can look for when we're concerned somebody might be having some suicidal ideation or thoughts? Elaine, do you have any input on what we can look for with other people that we see might be facing some of those challenges?
Yeah, thank you. And I think any one of us, anybody in the community could come across someone who's at risk for suicide. And knowing that, just like we know the signs of a heart attack or we know signs of other kinds of conditions, is really helpful. And then the next step is, what do you do about it? So some of the things we want to be watching for, if somebody's, especially with people that we know, if they're isolating or if they're getting more agitated, if there's behavior changes, if they are angry all of the time. A lot of times depression can have a very close association with people thinking about suicide or thinking about dying. So if we start to see signs of depression where we see changes in eating habits, changes in sleeping habits, again, people maybe not being able to concentrate, not doing the things that they used to love to do. And it certainly gets harder when we're all doing things virtually to be able to connect with each other. But if somebody's isolating and not connecting with people or not showing up on screen when they're, supposed to be either in school or at work or in a meeting, you just start to wonder, are you okay? And so it's really important to check in with somebody if you're worried about them. And don't be afraid to ask them how they're doing, and even ask directly if you're worried about them thinking about suicide. Sometimes you make comments like, I want to die, or I wish this was over, or, I can't do this anymore. We absolutely want to lean in when we hear those kinds of remarks or see any indications that people are feeling that way.
Suze, now Dover Mental Health Alliance, and I'm talking about this like I don't have a role in it, but
You do.
Can you kind of elaborate what Dover Mental Health Alliance is trying to do in the Dover community?
So yeah, we are trying to plant the seeds of culture change to create basically a mental health friendly community. And we've started here in Dover, but we're starting to actually expand outwards from Dover. And we're more than happy to do that, or to have other communities build their own alliance. For example, I'm in I've been working a little bit with the mayor of Somersworth and the incoming superintendent, and they want their own Somersworth Mental Health Alliance so that we can really start to talk about publicly the things that Elaine was talking about regarding observing signs and symptoms and knowing how that it's okay to ask somebody if they're okay, and to really remove stigma regarding what mental illness is and what it isn't, so that we can empower people to get the help they need without feeling shame or discrimination. So a lot of our work is like public campaigns, with working with mental health education and awareness, and that includes suicide prevention as well.
They are all tied together, and I'm so excited hearing what you're talking about, Suzanne, because it really is culture change. And the more we can address it openly, the less stigma there is going to be about it, and the more likelihood people will get help for things that they shouldn't be ashamed to get help for. And in fact, it's important to get help early on. And that's why it's really good when people are trained and understand what to look for, because if that person won't ask for help, perhaps somebody that cares about them can step in and said, let me help you make that call, or I'm worried about you, I'll go with you to an appointment, or, let's stay together and make sure that you're okay, and do whatever it takes to keep somebody safe until they get through whatever they're experiencing. Because most of these things can be resolved, or a crisis, even a suicidal crisis, can be temporary. So it's really important to stay with the person and keep them safe until which time they get the help that they need and that crisis is resolved.
So interesting. Cora and I, she mentioned earlier that she and I were trained as trainers in youth mental health first aid, which is a program to teach adults how to recognize and respond to youth in emotional distress. And Cora, I'm sure you remember this, but one of the things that we were taught in that is to offer hope, like, yes, you're going through a hard time right now, and I want to recognize that, and I'm here for you. You are not alone, and there's help available, and recovery, or your path to your recovery, is possible and probable. And I thought I loved that phrase that recovery is possible and probable. Even people living with a severe mental illness. I mean, there's lots of people walking on the streets that are living what you consider a normal life, going to work every day, raising a family. They manage their symptoms, and they can really succeed just like any one of us. So it's one of those things that if people don't realize that, and they think, oh, they have mental illness, they must be over here. But no, it's any one of us at all times or any time. So it's fascinating, really, work. And to also help the community understand that we all have mental health. And at times we're really, really down sometimes, and sometimes we are not. And things happen in our life, so it's okay to not be okay from time to time, just as long as you recognize that and reach out for help.
And look what we've been through globally, who
Yeah.
would have some kind of mental health problems after, a year plus in a pandemic, right?
Right.
And just to speak to what you just said about, stigma, and this really could be anybody, I want to put a pitch in that if you can ever have the opportunity to hear one of the NAMI New Hampshire in our own voice speakers, they talk about their experience living with mental illness and how they have gotten through to recovery. And it's amazing how inspiring they are, because you think, oh my gosh, they've been up against all kinds of odds and they're doing okay. And they really do represent the large majority of people who struggled with mental health, substance use conditions, and suicidal thoughts. And yet they come through the other side, and now they know how to cope, sometimes much better than the rest of us, because they've had to do it because their lives depend on it.
Right.
But they are really, talk about a story of hope. Those folks not only inspire people, they help some other people get help who might not have otherwise, when they hear that, wow, you've been through it and you got help and you're doing okay. I guess I can.
And they're talking about it. And that's really key too, when people are actually talking about things. Yeah. Out loud, talk out loud. Yeah.
Yeah, because substance use disorder and mental illness are so often co-occurring. And that is why I step into raising mental health awareness, positive coping strategies, recognizing when somebody might be having a mental health challenge or a mental health crisis, and getting them connected to the resources that they need to help them face those challenges they might be having in a healthy and constructive way. So Suze, you also work for Community Partners. Can you describe what Community Partners does for the Dover community, the Strafford County community?
Yeah, so Community Partners is one of 10 community mental health centers in Dover. They're scattered all about the state of New Hampshire, or to say not one of 10 in Dover, we're one of 10 in the state of New Hampshire. And we are the local nonprofit community mental health center for Strafford County. And a little bit more unique to other community mental health centers, we are also the developmental disability service provider and family support provider for folks living with a developmental or cognitive disability. So we have therapists on staff, we have psychiatrists on staff, we have a pharmacy right in house, and we work with people in short and long-term situations for for counseling. And it's there are people that are really struggling out there, and it's unfortunately, our therapists and all, they're not going to go out of business anytime soon, the people, but that just shows that there are so many people that are living and managing or dealing or struggling with a mental health challenge, and that we really need to recognize this and address it head on. And we need to do it in a community sense. The community mental health center can't do this alone in terms of mental health education or awareness or suicide prevention, nor can the hospitals or the ER rooms, nor can NAMI with the copious amounts of education and support they put out to our state. But it's going to take people like you and I talking to our neighbors, talking to our teachers, talking to our principals, talking to our business owners, talking to first responders to really bring about the fact that we all have a part to play in creating this mental health friendly community, or just bringing about more awareness. So, people know that, we all struggle sometimes, and sometimes it gets to a point where people start to think about, suicide, and that gets really scary. But if we as a collective can really be in the know and understand what those signs and symptoms are, and are empowered to actually act on something in an appropriate way, then I think, this is just my thought, is that we can really turn the tide on how our culture sees and views and reacts to those with mental health challenges. What do you think, Elaine?
I would say absolutely, you are right. We can, and we will make a difference. One of the things that I'm really excited to be working with your coalition on, and your community and Dover School on, is that we're going to be bringing the Connect training of trainers and a planning session to your community. And what you just described, Suzanne, is really what our model is all about. It's like bring everybody together, create a safety net, make sure we're all on the same page. We all understand the same kinds of things about what to look for in somebody at risk, how to talk with them, and where to refer them to, so that we can create a continuum and a comprehensive approach to, okay, maybe we can get you through this crisis without you always having to go to the emergency department, but we have other ways to support you. Or maybe we can work with you to make your environment safe, so that when you go home and you're feeling suicidal, somebody's going to be there with you, and you're not going to have access to firearms and pills and other things that might be, something you would use in a suicide attempt. It's really teaching people all the tools and knowledge that they need, but also knowing how they can connect with each other. And then that culture shift, which I just love the way you talk about that, and we're not afraid to talk about this. We know that it can happen to anybody. It's nobody's fault. And we want to support people who are struggling with mental health and substance use conditions, just like we would support them with people with any other condition, medical condition or otherwise, right? So you really can and will change the culture and shift and make for a place where suicide risk will be lowered. Mental health conditions will be more readily treated. People will be more comfortable, coming for help. I mean, all of those wonderful things can come out of the kind of approach that you're talking about.
Yeah, I'm really excited working in public health, creating this peer-driven network that's really aimed at addressing mental health challenges and substance use challenges within our community. Because who's the first person that notices these signs? Who are the first people that you go to discuss it? Sometimes it's scary for us to even have those conversations, and these programs and these education campaigns that we put out there are really geared towards providing your everyday person with tools that they can use, signs they can look for, and resources that they can use to help address those challenges that everybody, well, not everybody, but some people are facing right now. I know that sometimes those conversations are very hard. You know, they're even hard for me as somebody that does it for a living to have with other people. You know, you're always learning. Sometimes you're not going to say the right thing all the time, but it's important to try to learn what language is safe to use. You know, what is stigmatizing, what may be discriminatory. So part of the work that Dover Mental Health Alliance is doing is really kind of trying to end that stigmatizing language, using person first language, you know, making sure that people aren't afraid to come to another person and say, hey, I'm really struggling right now. I need some help. And providing the person that they come to, saying that, the tools they need to, you know, actively listen and respond in a way that's meaningful and helpful to the other person, and connect them with help, you know, if they are in a crisis stage. So I think that we're all doing really important work, and I'd love to see it continue. It's really taking off, especially with Dover Mental Health Alliance and what they're doing. And we have 60 new youth mental health first aid instructors in Strafford County. That's Strafford County Public Health Network and UNH partnered with the National Council on Behavioral Health, to provide adults working with youth or concerned adult citizens with youth in their life that might be experiencing mental health challenges. So, Elaine, can you describe just a little bit what the Connect training provides?
Sure. So NAMI New Hampshire developed the Connect program about 20 years ago. So it was designed and implemented for New Hampshire. And it is a comprehensive program that looks at suicide risk, warning signs, how to identify someone, how to intervene with somebody, and then what to do when you've gotten to that point. And it includes protocols, and it includes, you know, technical support and training. And we will be able to train trainers. We'll be able to do planning sessions with you so that you can engage lots of different key stakeholders from around the community, and hopefully create that safety net. So when a member of the school or a community member or a pizza shop owner or, you know, a mail, you know, somebody delivering mail, identifies somebody at risk for a variety of different reasons. It might be, wow, I deliver their mail every day and I notice they're not answering the door and they don't mow their lawn anymore. What's going on with this person? Or I'm coaching a kid at school and it's after hours and I'm noticing that they're not showing up for practice. What's going on with that? We can all start to identify when we're worried about somebody. And then with the tools and the reduction of stigma about, okay, it's up to me to do something with this. And as you said, Cora, sometimes we don't know what to say, but just showing somebody that you care can make a huge difference. And just saying, I'm not quite sure, you know, how to help you, but I'm here and I care and I'm going to make sure that I stay with you until you get the help that you need, right? That can say so much to somebody, as opposed to, it's not my problem, or I don't want to go there, or I don't want to say the wrong thing. And then you walk away and then you've left somebody who's basically saying, I am alone with this, and I guess I won't turn to anybody for help because people don't know what to do. The Connect program does the opposite. It says to youth as well as adults, there's many, many people you can turn to in the community that are going to be ready to support you. And then we're going to look at how we interface with each other so that if the police get involved, they know how to do a warm handoff to the mental health center. Or if the school, you know, needs to do a referral to the emergency department, they can do it in a way that feels trauma informed, that the family isn't feeling really scared about what's going to happen next, that the youth, you know, or whoever the family member is, you know, understands what to expect, you know, so that again, everybody's getting something that isn't going to be a surprise. It isn't stigmatizing. It isn't, you know, it isn't going to be wrought with, you know, unknowns and unexpected things, that we can all do that. And then we follow up with them afterwards and we say, hey, I'm checking in. I know you had, you know, a difficult time the other day. How can I help you with this? And I just want you to know I'm here for you. And that way the person feels, and there's research that shows this, they feel like, okay, I'm not some kind of a, you know, a freak or anything. I mean, if somebody had come to if I had an ambulance come to my house and take me to the hospital because I was having a heart attack, you'd be sure that neighbors would show up a day or two later and say, hey, I'm checking in. How are you doing? You know, can I bring you some food? We can do the same thing with somebody who's had a mental health crisis, right? or has had an experience with feeling suicidal, and we can just follow up and say, I'm here, I care about you, and I'll help you get help any way I can. And then people will ask for help, and many people won't need to get to that crisis point because they'll know that they can turn to people in a way that's going to be supportive and really involved in a meaningful way. So the protocols kind of help shape that because it tells people what to do, and it gives you some things that you can add into your institutions that help codify and create a sustainable kind of approach to suicide prevention. And it builds out on that main approach that Suzanne was talking about in terms of changing the culture and the way we think about mental health, substance misuse, and suicide risk.
Cora, if I could share one thing I've been doing, because it's Mental Health Awareness Month, I've been doing some radio interviews and things like that. And one thing I keep saying is that everyone should have programmed into their phone the National Suicide Prevention Lifeline. That shouldn't be something we have to Google at a moment. We should be able to pull it right up, because you just never know when you might actually need to access 24/7 confidential crisis counseling help. So I'm going to just want to give this number out. It's 1-800-273-8255. It's 1-800-273-8255. And it's manned 24 hours a day, 7 days a week with crisis counselors. The person that's actually having a crisis obviously can call that number, but also if you are concerned about someone else, you can call that number for assistance and guidance as well. And we can also text too. So many people are texting obviously these days, and you just text GO, the word GO, to 741-741. Again, it's manned 24 hours a day, 7 days a week, and it's confidential. I think it's one of those numbers that, we know 911 off the top of our head, right? Well, we should also know this number too. So plug it in your phone, then you don't have to remember it, but just know what it is. So, but I just have been really trying to promote that number. So people have it right off the top of mind.
And it's good to know that the number, if you dial the National Suicide Prevention Lifeline number, they have, there's different crisis stations all around the country. And the one that responds to the calls in New Hampshire is right in New Hampshire. It's up in Lebanon. So you're going to get somebody local. And if necessary, they can reconnect you with some resources right in your region and know what those are. And that is a 24/7 number. So we work very closely with Headrest, and they are a great organization.
Awesome. Suze, did you want to bring up our Out of Darkness event?
Oh, right. Forgot about that. Actually, that's right. So this program, what we're doing right now, is actually airing on May 14th, which is the Prevent Suicide themed day for the National Prevention Week. But on May 15th, the Dover Mental Health Alliance, along with the American Foundation for Suicide Prevention, we are teaming up to do our first ever Out of the Darkness event here in Dover. A lot of times we've gone to Portsmouth to partake in that, but we're going to do it right here in Dover. And because we can't still maybe frowned upon to do a huge group event with like a walk or a run or something like that, we are doing a rolling event starting on May 15th and going till June 18th, where we encourage people to get out and find what we call checkpoints around the city of Dover. And the checkpoint is basically kind of one of those corrugated signs on like an H-frame wire. You see them like political timeframes. It's those kind of checkpoints. And we want people to get out and walk, run, jog, do yoga by the sign, but go out and try to find those checkpoints and take a selfie, post on their social media, use some hashtags like DMHA, you are not alone, or DMHA stop suicide, hashtag DMHA stop suicide. And we really want to create a buzz and see if we can get folks to register and do this event for that whole month. We get a whole month, and we'll have 20 checkpoints around the city of Dover. And if we can get a number of people to register and then take selfies, I mean, you know how social media works. It just kind of builds and blossoms exponentially. So we're proud that we're going to start this event here in Dover, and hopefully next year, we're hopeful that we'll do it again, but it will be an in-person event with people walking. But we just encourage people to get out and start really finding those checkpoints and really start to think about how one can become educated on preventing suicide and mental health challenges and things like that. So thanks for reminding me, Cora.
No problem. And again,
I'm just going to mention also,
Elaine.
NAMI New Hampshire Walk is in October, but it will also be virtual, and similarly, people can do virtual things all the way through the year and then take pictures and post them. And the NAMI New Hampshire Walk is probably the biggest event for mental health and suicide prevention that has happened in New Hampshire for the last 30 some odd years. So we invite people to be part of that as well. And you can do that virtually from anywhere. So
That's usually in Concord though, correct? But this year, yeah.
if we hold it in person, yes, but last year it was virtual, and that meant you could do it from any location. And we'll have walk signs that people can hold, like you said, where you can take a picture of yourself with your team or by yourself or with your dog or whatever you're doing, you know, whether you're, you know, rollerblading or you're hiking or knitting or baking a cake, you can create something and do it in honor of mental health awareness. So
That's awesome. So for, I want to, if we have on our Facebook page is at Dover MHA, that's Mental Health Alliance at Dover MHA. We have an event page there. It has all our events for May, which is Mental Health Awareness Month. I'm sure that walk, Elaine, that you spoke of, it's on your NAMI New Hampshire page. It's all set up. Yeah. Okay, good.
Yeah, so and Strafford County Public Health Network also has a page on Facebook. It's at SCPHN. And we actually share lots of our community's efforts. We'll probably share Dover Mental Health Alliance's walk campaign. We share stuff from NAMI New Hampshire. We try to bring everything that's happening in our county and the state that really revolves around mental health and substance use disorder into one place, so people can go there, see what's happening in their community, and really participate. We have working groups throughout our community. Strafford County Public Health Network, I lead the prevention leadership group. Every first Tuesday of the month from 9 a.m. till 10:30 a.m. and people can come in and join if they want to do some work as far as substance misuse prevention goes, or any kind of mental health initiative in the community. We can work towards creating that mental health friendly community that we're really aiming for.
lots of ways to get involved and be part of it.
No shortage. But it's good. We need to reach lots of people, so that's good. Yeah. So Cora, I think that we are running out of time here.
Yeah, I think we can call this meeting adjourned.
All right. Well, thank you for having us. We appreciate it.
Thank you.
Thank you.
All right.
Bye-bye. Take good care.